It's important when seeing any patient with an infectious disease that you keep yourself safe, and you can do this by using PPE or personal protective equipment. To do this, you need to sanitise your hands, you need to put on a gown, put on a mask, put on protective eyewear and gloves. It's important that you put this on in a clean zone away from where you're going to be removing the PPE. And it's really important that you take your time to do this because you need to protect yourself. Hand hygiene, also known as hand sanitising, can be performed using an alcohol-based sanitizer product or hand washing using soap and water. The proper order when performing hand hygiene with an alcohol-based sanitizer is to firstly rub your palms together, then rub the back of each hand, rub between your fingers, ensuring you get all the way down to the webbing. Rub your fingernails on the opposite palm, rub around each thumb, and finally finish by rubbing the sanitizer over your entire wrist. Now that your hands are disinfected, pick up the gown and put your arms through it. You'll want to ensure that the gown covers the front of your body from your neck to your knees and wrists. Secure any ties, Velcro tabs or closures around your neck and waist. There are two different types of masks that can be used as PPE. A basic surgical mask is used for contact and droplet precautions. To put on a surgical mask, make sure the thin metal wire is positioned at the top. Holding it by the straps or ties, place over your face and secure it. If your mask has elastic straps like this one, they go over each ear. Other masks may have an upper tie that should be secured above the ears on the middle of the head, and a lower tie that goes below your ears around your neck. Ensure the top of the mask is covering your entire nose and apply pressure to the metal wire to mould it to the bridge of your nose. Extend the bottom of the mask to cover your chin. The mask should fit snugly. Check this by breathing deeply. The mask should not flap. A P2 N95 mask provides a higher level of protection than a basic surgical mask and is used when airborne precautions are required. To put on a P2 N95 mask, first select a mask that fits you well. Holding the mask with the metal strip face up, pull out both straps. Tuck the bottom of the mask under your chin and cover your nose. Stretch the straps behind your head, placing one above the ears and one below. Take your fingers and press down on the metal strip to mould it to the bridge of your nose. Press around the edges of the mask too, in order to ensure a seal against your cheeks and face. The mask should fit tightly and be sealed all the way around. Check the seal by breathing in and out while placing your hands along the top and sides of the mask. You should not be able to feel any air leakage, and the mask should be drawn in when inhaling. If you notice a leak or cannot achieve a good seal, adjust the mask as needed or try a different style or size of mask. Please note that it can be difficult to guarantee a good seal if you have facial hair. People with facial hair should consider shaving before using a P2 N95 mask. After you've correctly put your mask on, you should place your protective eyewear over your eyes and adjust them to fit. Try not to move your mask while doing so. If you do, you should recheck it fits again. Finally, repeat hand hygiene. Place your gloves on your hands, making sure that both gloves extend over the wrists of the gown. It's important to know that after putting on your gloves, you should not touch your face or mouth, nor seek to adjust your eyewear or mask further, especially when near the patient or after the examination. Avoid touching any other objects. Make a final check that everything is in place. You've now correctly donned your PPE. Once you're ready to remove your PPE at the end of the clinical examination, you need to move to a designated dirty zone at an appropriate distance from the patient. The distance will depend on the presentation of the patient and may be outside the examination room. A clinical waste bin, as well as hand sanitising equipment, will need to be available where you take off your PPE. The first step to removing PPE is to take off your gloves. The outside of the gloves should be treated as contaminated. Pinch the cuff of one glove. Use that to carefully peel off the first glove, taking care not to contaminate your skin at any point, and keep hold of the glove. Take your now ungloved hand and slide your finger carefully under the remaining glove. Peel off the second glove turning it inside out over the first as you do so. The removed glove should now be placed in a clinical waste bin. Some guidelines recommend hand hygiene after each step when removing PPE. Hand hygiene is important at any high-risk step or if contamination has occurred. To be clear, do perform hand hygiene between steps if you've contaminated your hands in any way. With your now ungloved and clean hands, grasp the headband or the inside of the side arms of your eyewear from the back and lift them away from your face. Do not touch the outside of the eyewear. That should be treated as contaminated. If they are disposable, discard the eyewear into a clinical waste bin. If they are reusable, place them in a designated container for later disinfection. When taking off the gown, the front and sleeve should be treated as contaminated. Unfasten your gown, starting with the bottom closure, followed by the top closure. Taking care that your sleeves don't contact your body. Slip your hands underneath the gown at the neck near the shoulders and peel away from the shoulders and over the hands. Making sure to only touch the inside of the gown, turn it inside out and fold or roll into a bundle. Discard the gown into a clinical waste bin. The front of the mask should be treated as contaminated and never touched. Grasp the bottom ties or elastic followed by the top and pull them over the head to remove the mask. Discard the mask into a clinical waste bin. At this stage, you should perform thorough hand hygiene. Firstly, rub the palms together. Rub the back of each hand. Rub between your fingers, ensuring you get all the way down to the webbing. Rub your fingernails on the opposite palm. Rub around each thumb. And finally, finish by rubbing the sanitizer over your entire wrist. You've now safely removed and disposed of your PPE.